Some of you may think itchy scrotum is something that is very mild and it's a transient thing that, with occasional scratch in the pants, it solved the problem. True, however, for many people, the itchiness actually can be persistent, and that persistent can be embarrassing. Worse still, all that scratching will cause breaches and secondary skin infection. We're going to focus on what causes all these and also what are the treatments. First of all, if you divide it into an infective condition and non-infective condition. The non-infective condition usually it's something that is generally dermatological. For example, lichen simplex. For example, dermatitis of the scrotum. For example, scleroderma, and for example, psoriasis. And a lot of these, we don't really know the cause of it. It could be allergy, it could be hygiene, or it could be just the skin condition. It's very sensitive to things such as soap and also materials such as the underwear like nylon. Interestingly, there are many studies to show that things such as apple cider vinegar that apply down there, or even tea oil cream that apply down there, or even coconut oil. And all these have been demonstrated that the natural antibacterial effect of these natural remedies actually help to soothe the skin and to soothe the itch. On the other hand, there are infective causes such as candida infection or fungal infection of the scrotum. It's very common. It commonly happens to somebody who's got lower immune system or somebody who's on antibiotics. I'm sure you've been there before. When you're taking antibiotics, then the skin started causing some deterioration and itchiness. And that itself will resolve most of the time with cessations of the antibiotics. However, antifungal cream or the antifungal medications itself is particularly useful. Other scrotal conditions that can actually cause itchiness can be sexually transmitted infection. Yes, something such as the herpes simplex 2 virus can cause significant inflammation, pus, and also blisters around the scrotum and cause quite severe itchiness. On the other hand, scabies and lice that is transmitted during sexual transmission is particularly itchy and needs to be treated with special shampoos and special medication. Next week, we're going to talk about something that causes enlargement of the scrotum, and it itself has a pulse that is exacerbated by cough. What am I talking about? I'm going to talk about inguinal hernia. So if you have got hernia or you suspect you've got hernia, then you need to stay tuned in next week's Putting Dr. G on the Spot.